Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an August 31st, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today is 2,036, which is 77 new cases since my last report on Thursday, August 27th. The total number of COVID deaths remains at 36 in Dubuque County, and 8.4% of the over 24,000 people tested in Dubuque County have been positive overall since March. That's the overall positivity rate. The 14-day average positivity rate is 7%, according to the Iowa Department of Public Health. As of Saturday, 7 Dubuque County individuals were currently hospitalized in Dubuque County, and 75% of Dubuque County positive cases have recovered to date. The state added 5,118 cases since last Thursday, August 27th. As of August 31st, 2020 at 2 p.m., Iowa has a total of 64,820 positive cases. In all, about 1 in 5 Iowans, or over 630,000 people, have been tested, and just over 10% of Iowans tested have been positive. Yesterday's state 14-day average positivity rate was almost 11%. And deaths reported in the state total 1,116 Iowans. Currently, 299 cases are hospitalized throughout the state, and finally, about 72% of Iowans have recovered. In related news, you may have read the New York Times article yesterday stating Iowa had the fastest growing caseload in the country, and about the number of cases occurring in Iowa. Not exactly the headline we want to see. The New York Times stated that over the past week there have been an average of 1,165 cases per day in Iowa, an increase of 131% from the average 2 weeks earlier. And this is confirmed by the data portal on the CDC website. A total of 7,464 cases have been reported in Iowa for the last 7 days as of yesterday, August 30th. Remember, Iowa is now reporting probable or antigen-positive test results. Antigen tests are those referred to as rapid tests, the kind you get results from while you're waiting in the clinic office. Previously, a positive antigen test had to be followed up and confirmed by a viral test. This is no longer the case, and especially if the person is a contact of a positive case or exhibiting COVID-19 symptoms. This change in reporting often occurs in disease outbreaks or epidemics, so it's not unusual to start including rapid test results in the number of positive cases. Much of the increase in cases is a result of universities and college students returning for the fall semester. Primarily the larger universities of Iowa State and University of Iowa. This is logical since they have the largest enrollments. In Johnson County, which is home to the University of Iowa, 75% of the positive cases are in the 18 to 40-year-old age group. And in Story County, home of Iowa State, 77% of their cases are in that age group. Dubuque County's 18 to 40 age group currently has 50% of our cases, which is still significant. The Public Health Incident Management Team continues to work and communicate with the pre-K through 12 schools, colleges, and universities on a daily basis. As all the schools have started up and implemented their COVID-19 plans, we are working on contact tracing of positive individuals with the schools so they can promptly start their 10-day isolation and identify close contacts to begin their 14-day quarantine periods. The schools will all be balancing positive cases in students and staff, along with monitoring the number of people out due to quarantine as part of their daily routine. These absentee rates, along with a variety of other metrics, will inform the schools on many things, and whether to continue in-person classes, and how to do other school-related activities such as larger classes, assemblies, extracurricular and sporting events. So speaking of school sporting events, we ask everyone to limit attendance at those events. And if you do attend either a volleyball, football, or other event, distancing and mask wearing are key. Keep in mind that talking, and especially loud talking or cheering, can increase the chance of spreading the virus greatly. All the more reason to keep your distance from other spectators and spread out. Masks are not intended to protect the wearer, but rather to reduce the risk of spreading COVID-19 from the person wearing the mask, who may not have any symptoms of the disease. Masks should be worn by coaches, youth sports staffs, officials, parents, and spectators as much as possible. And finally, and most importantly, don't attend a sporting event, or any event for that matter, even as a spectator if you are not feeling well or experiencing any COVID-19 symptoms. The New York Times article summed it up all very well in terms of the factors that matter the most. They are how close you get to an infected person, how long you are near that person, whether that person expels viral droplets on or near you, and how much you touch your face afterwards. Those 4 factors all point to physical distancing, mask wearing, hand washing, and not touching your face, particularly your eyes, nose, or mouth. Same stuff we've been saying during every cold and flu season. I know it's not exciting news, but it works. Thanks for tuning in today. This week, let's not focus on the state's data reporting glitches due to their most recent software and website maintenance. Instead, let's concentrate on how we, as individuals, can take responsibility and do actions and behaviors to prevent the spread of COVID-19. Because we're all in this together.